week on Prepping 2.0.
Inexpensive, life-saving drugs. We're talking about ivermectin, hydroxychloroquine, vitamin D, stuff that's been on the market for decades. Ivermectin won a Nobel Prize. It's such an effective drug, and it has such a wide range of positive effects, safer than aspirin.
When disaster strikes, will you be prepared? This is Prepping 2.0 with authors and prepping experts Glenn Tate and Shelby Gallagher.
Online at prepping2-0.com.
Get ready. Prepping 2.0 coming in 3, 2, 1.
Welcome, everyone. This is Shelby Gallagher over here at Prepping 2.0. Normally, I would say joined by my partner in life and co-host on the show, Glenn Tate. As many of you know, especially if you listened in the last couple of weeks, Glenn Tate is recovering from COVID miraculously. No kidding. He should be 6 feet under right now, and God has saved his life. And he is still recovering. He's still in the hospital. He's still regaining strength. So I have a pinch-hitting co-host with me right now, and you've heard him on the show before, Jeff Reynolds. Welcome, Jeff Reynolds.
Hey, Shelby, it's great to be here. I've been, even though I'm not a man of faith, I've been praying for Glenn, and I know thousands of other people have been praying for Glenn around the world, and it truly is a miracle that he has recovered so quickly. Because everything I saw was, I was starting to lose hope.
Yeah. Oh, yeah, absolutely. It's truly a miracle. If anyone wants to see my updates that I try to do daily, I put them on the Prepping 2.0 Facebook page, and you can find that link at prepping2-0.com. Click over there. You'll see videos, and it's just kind of me sitting on my couch yammering about kind of what's happened and what the update is for that day. And everyone's comments over there are just heartwarming, and I appreciate all of them. And we're going to talk today. We're going to talk today a little bit about COVID, but I want to give a quick shout out, and I've organized my thoughts on this a little bit more. I think you all will appreciate that. Give a quick shout out to our awesome sponsors that honestly keep the show going. So right off the bat, I want to give a big shout out to Minutemen Coffee. Great folks over there, unabashedly pro-American, pro-Constitution, pro-Second Amendment, unabashedly. When you place an order with them, you are going to get a Constitution in your order. I encourage you to check them out at prepping2-0.com. Click over on Friends and Affiliates. You'll find them there. When you place your order, be sure to use the coupon code I Miss America, and you will get 15% off. Other quick shout out to EMP Shield. They have developed devices to protect your devices in case of an EMP or a coronal mass ejection. Protect your home, protect your vehicle, your generator. They have an awesome coupon code that if you use Prepping 2.0, you get $50, not 50% or any crazy number like that, but $50 off each device, which is really great. So check them out over there at Prepping 2.0. So to our co-host, I'm really excited about this. Jeff Reynolds recently went to a summit about COVID. And I know I did a show a couple of weeks ago on just my anecdotal research. Well, Jeff has been to the summit where heard tons and tons of frontline information. And I wanted to bring that to you folks today because so many of you have commented. I'm so glad you're talking about this, Shelby, because I'm now up in my preps in terms of how to prevent this from hitting my family. So Jeff, right off the bat, tell us about this summit.
Yeah, and thanks, Shelby. And before I move on to that, I want to, as a professional pinch hit co-host, I want to congratulate you on properly pronouncing CME. I know that's been a struggle in the past, and so well done on that.
Thank you so much.
But yeah, there was it was the Global COVID Summit in Ocala, Florida. It was last Saturday, the 6th, and I heard about it last minute and was able to wrangle my way in the door. And it was put together by a gentleman by the name of John Littell. He's a doctor in practice in Ocala, and he brought together some of the foremost experts on COVID and immunology and virology from across the world through the frontline. It's the Frontline COVID Care. Oh gosh, it's the FLCCC
yes.
Association. Anyway, it's The website is globalcovidsummit.com/Florida. So you can check out the entire thing on that website. And it's actually quite amazing because the entire thing, he put it together. I did an interview with the guy, and I'm going to have an article published tomorrow on this at PJ Media. But he did this entire thing in like 3 weeks, threw it together and put out feelers and got all these amazing clinicians to show up and do the summit itself. The first segment of it was by Dr. Robert Malone, who invented the mRNA vaccine technology. And he went on for a good half an hour, and he went into such depth. It was like being back in college for me. It was a graduate level refresher course on virology and immunology and how the immune system works and the cellular level effects of the spike protein and all this stuff. And it was so in depth that it actually qualified as continuing medical education credits for the doctors who were in attendance.
Wow.
And like I said, they threw it together in 3 weeks. They had over 1,000 people attending, and these are all people that are doctors or other employees in hospitals who were there to understand how to treat COVID, the disease.
That's awesome. That's awesome. And one of the things I've been struck by in this whole experience with myself, my own COVID experience and I just kind of nursed myself at home because I didn't have any symptoms that drove me to the hospital like Glenn did, if you've watched the videos on the Facebook page, I went to an attorney asking for to help me get some of the alternative medications that I know are out there, and the hospital was refusing, and you'll get the details on that here soon if you don't know what happened with that. But I remember talking to the attorney, and he said to me, what's really ridiculous is we've now been doing COVID now for almost 2 years. We know what works. We know what doesn't. And we're still having this conversation of how to get the stuff that works to the people who need it. So it's become a politicized tragedy with this. And you'll see what I'm talking about the more we talk this out. But really quick, always got to give a quick shout out to our awesome sponsors. And I've really tried to piece this up so you don't hear 12 of them all at once. Numanna Foods. Numanna Foods is awesome. They do a great job at bulk freeze-dried food. So this isn't, a quick little meal that you can take camping or hunting. This is bulk, like a whole lot of it kind of food. And they do have special dietary things in case you have a dietary restriction. Check them out again at our website. And if you use the coupon code PREP, lowercase, at checkout, you get 10% off your order. Other great gal, Lizzie McDaniel, one of our wonderful realtors over in Tennessee. She is part of the redstaterealtors.com website that Glenn has been and he will continue to work on getting getting people connected with realtors in red states to help them make the move so they can settle down and prep and maybe even get into the homesteading kind of lifestyle. Lizzie's awesome. You can find her at redstaterealtors.com. She's one of us. One last one here, My Kind CBD. It's a new CBD. Well, they're new to us, CBD oil. And I know there's lots of choices out there. Glenn recently did a VBS with them on why My Kind CBD is awesome in its purity and its effectiveness. And I'll say this, Glenn has used it a lot as he's kind of wound up his whole cancer treatment. Probably going to be using it as he recovers from COVID. And I'll tell you this, my teenager, who every week plays a pretty hardy and hard football game, uses it quite a bit as well. And we've really enjoyed their products. So if you go check them out on our website again, use the coupon code GLENN at checkout, you get $5 off. So let's go back. I want to jump back in over to Jeff because we have so much to talk about. So one of the points that we wanted to talk about, and I think this is a really important one, and if you want to revisit something, stop me, Jeff, but one of the big things that institutions are pushing right now is vaccine kids, and that just scares the bejeebers out of me because
and it should.
It should. So yeah, if unless you want to cover something else first, can we go in that direction?
Yeah, absolutely. And if you go to the website for these guys, they have a whole manifesto kind of statement that has been signed. It's sort of a statement of principles, and it's been signed by almost 13,000 doctors all across the world. It's the Physicians Declaration 2. You go to doctorsandscientistsdeclaration.org, and there's a whole thing here, but there are three main points. The three main points that they are trying to make and that they made at the Global COVID Summit last weekend is no childhood vaccination. They are firmly against this based on a lot of factors. One is that I saw somewhere, and I can't confirm this off the top of my head with a link, but I saw somewhere that there was something like an 800% higher risk of myocarditis among kids who are vaccinated versus kids who get COVID. COVID is not passed very well from children to pretty much anybody except the very elderly, because they have more robust immune systems. So that, and we can go into a lot of detail on that if you want to. The second principle that they are standing for is that natural immunity to the virus is at least as good as the immunity you get from the vaccine. And there are lots of problems with the vaccine. I can go into chapter and verse with the science behind what's wrong with the vaccines. But I would definitely go to the website to check out the details on that. It's COVID19criticalcare.com is the FLCCC website. And the third principle is that these medical therapies and these early treatment protocols and these inexpensive life-saving drugs, they repeated that particular phrase over and over and over again last Saturday. Inexpensive life-saving drugs. We're talking about ivermectin. We're talking about hydroxychloroquine. We're talking about vitamin D. We're talking about stuff that's been on the market for decades. Ivermectin won a Nobel Prize. It's such an effective drug, and it has such a wide range of positive effects with a safety protocol that's safer than aspirin. So the fact that these things are being suppressed and people are not, and doctors are not being allowed to prescribe these medications to save the lives of people and keep them off the ventilator, and pharmacies are not filling prescriptions created by, that are actually written out by doctors in good standing with medical licenses and medical degrees. The fact that government agencies are standing in the way of doctors treating their patients. And that was a big point that Dr. Littell made in the interview that I had with him that I'll publish tomorrow, was he has seen so much intervention into the exam room by the federal and state government bureaucracies. He's at his wit's end. The amount of intervention by untrained bureaucrats, people that don't have medical degrees, that are telling him what he can and can't prescribe for patients that are sick.
Oh, my word. Okay. So those are the let's go unpack some of this if we can. Holy crow. So here's... I told
you, I observed, it's like a sponge in a fire hose. There was so much to absorb. Yes. It was crazy.
So let's go back to the not vaccinated kids. So, and again, I have, what's weird is as you say these things, I'm like, yeah, the Glenn and Shelby family just went through this. So all three of us in our household got COVID all at once. And what we didn't realize is that Joel had it because he just kind of was like, he has a cough. He's a little bit tired. It's like he has a cold. Didn't even faze me. He was playing football. I have pictures of him on a football field playing hardcore, because he doesn't do anything soft. Hardcore football. Probably at the same time he's positive for COVID, and other players that he was with were too, because they didn't have, the fever, the this, the that, the other thing. So
Well, and we've known this ever
Yes.
since. I mean, we've known this from the beginning, since it was actually declared a pandemic back in February, March of 2020,
Yeah.
that it doesn't affect kids anywhere near as much as it affects the elderly, that the elderly are the most vulnerable
Yes.
to this, and people with comorbidities, high BMI or obesity or diabetes or lung disease or immunocompromised.
Yes.
Those folks are in a much higher risk category. Now, also, one thing I want to mention that is on the FLCCC website that nobody ever talks about is the fact that you and Glenn both got COVID,
Right.
and you were down for the count for a while, and you described some pretty painful symptoms, and it was a pretty brutal week or so of really awful symptoms. But you stayed out of the hospital and you recovered almost fully, where Glenn went into the hospital, went on a ventilator, and is lucky to be alive.
Yeah.
It affects males much more at a much higher rate than it does females, more with severity, with transmissibility, and with just overall case rates. And the reason for this is that there's a gene on the X chromosome that expresses an it's an antigen that fights off coronaviruses. So if you have more X chromosome, you have more of this antigen being produced when you get sick with a coronavirus.
That's interesting. So I wonder. Never. Their sarcasm is running through my head, and you and I know each other well enough. I know you know where I'm thinking. So, so going back to kids. So again, we all get it at the same time. What made us all clue in that we have COVID in our household Glenn was in the hospital getting his ostomy bag, that whole thing reversed, and he tested positive while in the hospital. I'm starting to suddenly not feel good. I realize Joel's not feeling good, so I take some time off from work and I go get he and I tested. We're all positive. All right, got it. So calling the health department here in my county, because if they don't call you, you should call them, because, well, depending on what kind of a county you live in. I live in a pretty free county. So I had a great conversation with that person, and we just started counting back days to symptoms, and that's what you got to do. Joel probably had it for a couple of weeks before us with just that kind of simple cough, and kind of came out of it. He stayed home for a few days until his school approved him to go back, and blah, 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 blah. So he just kind of bounced out of it. And all along, I had been telling him, you're not getting vaxxed. And I would show him stories of what you just described, Jeff, of young, vibrant, and males especially. I think the vaccine does not do well for them. The myocarditis, you know what I'm saying?
Myocarditis.
Yes, where you have, it's a swelling of tissues around the heart, and it can be very debilitating, and it can lead to lifelong problems, heart problems. So I'm like, I'm not going to do that to you. If you get it, you'll be fine. And so what's really cool, we're all joking about, we have fresh new antibodies in our bodies that we all love, and it cost us a little bit, and it cost us a week of being sick at home. But what would I rather choose? Joel being sick for a week or two with a simple little cough and feeling tired, or a life sentence of heart problems? I mean, that's the choices we have. Go ahead.
Yeah, no, I just want to jump in with two quick points here about the vaccine itself versus natural immunity.
Yes.
One was Dr. Peter McCullough also spoke at this global COVID summit in Ocala, Florida last weekend. And he made the point that if the vaccine trials started in January of 2021, if he had still been in charge or on the panel of the FDA, which he's done, he's actually, this guy is brilliant. He has actually served the FDA in a capacity of approving or disapproving new drugs to market. And he said that if he had been on the panel in January, he would have shut down the vaccine trials in February based on all of the negative data that they were getting back from the vaccine trials. They are seeing huge increases in By the way, if you ever watch or listen to Steve Deace or Daniel Horowitz, their podcasts, they point out that the overall morbidity rate has gone up like 33% this year based on over last year, and that's after we got the vaccine. So what's going on? That's obviously
more
not
people
positive,
are dying,
but it's certainly a correlation. And so you're seeing actually an astronomical. The other thing that I heard the other day is that the number of adverse reactions to this vaccine outnumber by a couple of orders of magnitude all of the other vaccine adverse reactions that have ever been reported.
Combined.
Yeah.
Yeah. I've heard that too. Yeah. Ugh.
Yeah. So we're and I've heard Peter McCullough speak in the past that if they got this kind of negative data on the vaccines, they would have shut it down completely. And they were pleading, all of the doctors, Pierre Corey and Robert Malone and Peter McCullough and John Littell and everybody else. They were pleading with everybody in the crowd, please don't get your children vaccinated. It's not necessary, A. B, it's going to have negative reactions. So, it is absolutely true to say that those negative reactions are not anywhere close to the majority. It's still a minority of people who get the vaccine. But it's highly elevated based on what their own standards are of how many adverse reactions they should be getting. So, they are putting out the alarm. The kids don't need the vaccine. That's the biggest point.
Right.
We've known this all along.
Absolutely.
Kids don't need a vaccine because they are not as strongly affected by the symptoms of COVID as elderly people or people in risk groups. So once you get natural immunity, and this goes to the other point, is that once you get natural immunity, it is far superior to the vaccine immunity. The vaccine actually does not provide immunity that lasts. It's not durable, and the vaccine will also suppress natural immunity if you've had COVID in the past. So there's one. The vaccine actually inoculates, I suppose, is a word that fits here, but not exactly. But it inoculates against the spike protein. That's one protein that it inoculates against. Natural immunity involves over 50 different proteins, including the spike protein, including the virus itself, including the proteins that are expressed by the virus. And it creates B and T memory cells, which are the white blood cells that have the antigens to the virus, that have the memory to go and attack the coronavirus if you're exposed to it a second time and kill it before it expresses into a disease. That's what immunity is.
Yes.
And so all that, none of that is provided by the vaccine. The vaccine only vaccinates against the spike protein.
Isn't that insane? So we only have a few moments here before we have to take a quick break. And I want to kind of draw out a little bit more of this on the other side of the break, folks. This is fascinating, and I'm hoping that it equips you and we'll talk more about this on the other side, and helps you prep so that you can be ready to take care of yourself if you get sick. So don't go away. We've got so much more to talk about.
More of Prepping 2.0 with authors Glenn Tate and Shelby Gallagher is coming right up. Hear all our previous shows free online at prepping2-0.com.
Prepping 2.0 is about that next level of prepping. One of the key 2.0 items to have is bulletproof body armor plates. I used to think body armor was too tactical for a regular guy like me, but it isn't. Give yourself, your family, and your team an unfair advantage when bullets are flying. Body armor used to be expensive and hard to get. Not anymore. KD Armor, and that stands for Come and Take It, makes solid and affordable body armor for normal people. Get body armor while you can. The clowns in Congress are trying to prohibit future sales. KD Armor is the place to get it. CATIarmor.com. Prepping 2.0 listeners get a 10% discount when you use the coupon code GRANT.
When the grid goes down, darkness will descend fast. Used to be there was nothing you could do about an EMP, electromagnetic pulse, or CME, coronal mass ejection. Now you can protect your electronics, protect your family, thanks to EMP Shield. EMP Shield invented a simple-to-install device that prevents whatever's connected to it from frying in an EMP or CME, and it costs just a few $100s. EMP Shield has been tested by independent laboratories and passed muster with the government, which has ordered lots of them. Google EMP Shield and see for yourself. And save some money. Get a $50 discount per device. Go to prepping2-0.com. Click on the Friends and Affiliates page, then click on the EMP Shield logo. At checkout, use coupon code PREPPING 2.0. It's all one word.
Abe Lincoln here. In 1773, patriots broke the chains of British tyranny by throwing tea into Boston Harbor. On that day, Americans began drinking coffee. We celebrate that event daily here at Minutemen Coffee. All men are created equal. Coffee is not. Minutemen Coffee is roasted to perfection in small batches. Bold, smooth, and never bitter. Shipped to you fresh daily. Whole bean, ground, or our patented pods. www.minutemencoffee.com.
PrepperNet, where preppers unite. Looking to meet other like-minded people in your area? Looking to start your own prepper group? Already have a group? Join PrepperNet.com. PrepperNet has gathered the biggest names in the industry to help unite preppers everywhere. Join John Jacob Schmidt, Scott Hunt, Dr. Bones and Nurse Amy, Glenn Tate, Shelby Gallagher, Charlie Hogwood, Samuel Culper, Survivor Jane, Rick Austin, Franklin Horton, Ryan Mitchell, and Brian Duff. Our team is united. Check us out at PrepperNet.com. PrepperNet, where preppers unite. PrepperNet.com.
Shelby Gallagher here. We found that you need to layer your food preps.
Yeah, this is Glenn Tate here. A lot of times the hardest part of layering is the long-term foods. We love Numana foods, which have a 25-year shelf life and are non-GMO. Also, organic meals are available.
Numana comes in family-style portions and in bulk. This is not backpacking food. It's family meals that last for at least 25 years. The perfect freeze-dried part of your food layering.
You can get a sample of Numana meals for $19.95 and see for yourself. You will be amazed.
Prepping 2.0 listeners get a 10% discount by entering the code PREP.
Go to Numana.com or click the link on the Prepping 2.0 website.
Give it a try. Numana.com. That is Numanna.com.
Now, more of Prepping 2.0 with authors Glenn Tate and Shelby Gallagher.
Welcome back, everyone. This is Shelby Gallagher over here at the Prepping 2.0 show. Thank you so much for joining us on the other side of the break. Wanted to just bring out something that came out in the alternative news in August in regards to vaccinating kids. I'm very much against it because of all the things that Jeff and I have been talking about. But one interesting thing, and this is the politicized side of it. Those of us who remember back in August, all of 2.5 months ago, my goodness, it's so far in the past because all of this moves so fast. And there was that kind of big push to vaccinate kids as we're getting ready to go into school. The FDA had come out with a study saying, oh my gosh, all of these kids, we've got to immunize them because there's this morbidity rate that COVID has on kids. Johns Hopkins came around and dug further into that statistic and realized that that was not true information because the kids that had perished, sadly, from COVID were hugely immunocompromised. They had really extreme medical conditions, cerebral palsy, things like that. So yeah, if I have a kid with a really severe health condition, I might think about immunizing them, but I'm not going to think about immunizing and vaccinating the entire country. That seems a little bit too much. So anyway, I just wanted to give a little backstory on that. There's this political push to push this, to me, an unsuccessful and unhealthy vaccine on young, vibrant, healthy lives that can ride out a cough, essentially, is what it is. So let's go back to that, though, Jeff. I wanted to ask you about this. Let's talk a little bit more about the, not just superiority, but the golden superiority that natural immunity gives you.
Yeah, and before we do that, you made me think of something. The reason that I'm having my family not get vaccinated, other than just the general opposition to experimental drugs in my children, is my wife, who we have 2 kids, and we have had a total of 4 pregnancies. She had 2 miscarriages between our first and our second. And after the second miscarriage, she went through a genetic testing sort of examination and found out she had a very rare clotting disorder that was blocking the umbilical cord and killing the fetuses. And so when we got pregnant with our second child, our 4th pregnancy, I had to inject her in the abdomen with an anticoagulant every night of the pregnancy and for 3 months after the pregnancy because she developed a blood clot in her leg. So the point is that we know that these shots cause all kinds of clotting issues,
especially
and if
in
you
women.
have any sort of propensity whatsoever towards that sort of reaction, then none of the people that could possibly have this genetic issue should take the shot. And yet they're not making any sort of exemptions for that or any sort of medical exemptions for people to be able to go back to work even though they can't take the shot. So you talk about natural immunity. Natural immunity, and you know, I got a degree in science in college, so I'm somewhat up to speed for this. And when I went to the summit, it was sitting in on a graduate lecture. It was fascinating, and it was a great refresher. And I even talked to when I did my interview with Dr. John Littell, the organizer of the event. He's like, yeah, man, we had a lot of people that were like, wow, I haven't had a refresher like this in a long time. It had a lot of people taking notes. And these are people that are actually practicing doctors. So,
good.
But the natural immunity is so much more robust. And we know study after study after study has come out and shown that it is robust and it lasts. It's long lasting. Whereas the vaccines have already started to require booster shots.
Yes.
And they know that the immunity fades over time, and it is not a robust immunity that covers multiple facets of infection. It's just that one spike protein that it vaccinates against, and it's problematic even when considering that one protein. So there's a lot of detail I could go into, but suffice to say that it really is natural immunity is so much more robust than vaccine immunity that I've come to the conclusion personally that I would rather get infected, even though I'm overweight, I have high blood pressure, I have a couple of comorbidities. I would rather get the infection and overcome it naturally and build up natural immunity than to get vaccinated.
And I want to talk about that. Oh my gosh. And I just got you out a good break. So let's do a quick little, again, recognition of our amazing sponsors who keep the lights on literally. And these days, not gonna lie, helping to keep Shelby's lights on. So big shout out to Katie Armor. Love those folks. Katie is spelled C-A-T-I. Better way to think of it is come and take it. They specialize in steel body armor plates for everyday people. And as we watch, and as we're talking right now, we're about ready to see some more riots happen because a verdict is going to be brought down and someone's not going to like it. And, you know, why not riot? And why not, you know, wreak havoc, crime, and fear into a community and overwhelm the police departments? I really encourage folks these days to get a set of body armor from Katie Armor. If you use the coupon code GRANT at checkout, you get 10% off your order. Another great person I want to give a shout out to is Jared Savick. He and his lovely wife are realtors in the Kalispell, Montana area, and they specialize in helping preppers find a turnkey property, a property to build your dream house on, to prep in the Kalispell, Montana area. But don't let that discourage you. They are professionals and they know the area in town, out of town, and way out of town. Best place to reach them is at their website, Seize the Day Montana. That's seizetheDayMT.com. And when you send them a message, be sure to let them know Glenn and Shelby sent you. And great folks over there. So want to go back to And see, I do here we go. I have COVID haze in my brain. So it's funny that you should mention that, Jeff, you'd rather get rather not get the vaccine and get COVID and take the risk because you have some comorbidities and understand that you could go through some misery. So I want to come back to this and talk about what you're doing, what I have done so that, and I don't need to worry about it now that the whole entire family has the natural immunity, but what you're doing so that people can hear what you're doing to prepare. I think that's really important. So, but one of the last things I wanted to talk about, and we have, several minutes, and I definitely had this fight. And if you go back and look at the videos that I did the day before, Glenn went on a ventilator, and when that happens, all hope is lost because very few people come back from a ventilator, and Glenn did by the grace of God. I tried to get him ivermectin to him through the hospital. Someone brought it to me. They drove 2 hours, a total of 4 hours in one day to bring me ivermectin that I did not have for him. And I sent it to him through the hospital, not thinking that it was going to be confiscated as though I were a drug dealer in prison. And I got chewed out. I got dressed down, chewed out by his doctor for doing that. How dare I bring in ivermectin, which is a drug intended for third world country fevers and funguses and parasites and is incredibly dangerous. How dare you do that? I'm serious. These are words that were said to me. And good thing I had a mask on my face because I hid the scowl I was giving to him. That same man, by the way, walked into Glenn's room when he came off the ventilator, and Glenn said to him in his, post-ventilator haze, said to him, "You tried to kill me." And he kind of nodded and shrugged. Isn't that crazy? So I want to talk about, isn't that crazy? So I have instructed Glenn, that man walks in your room again, you tell him to get the heck out and call me, and we'll have another dressing down. It'll go a different direction. So wow, isn't that crazy? So that is our end of the story. But here's the thing. Talk to us. Why is ivermectin so important? And why should people have this in their medicine cabinet for every member of their family right now? Go, Jeff.
Yeah, so ivermectin is a very effective treatment against a lot of different things. Obviously, it's used in veterinary terms for, everybody accuses Joe Rogan of taking horse dewormer, and he famously smacked down Sanjay Gupta for saying that.
Seriously, people need to go to YouTube and watch that because that's epic. That's an epic dress down.
It was awesome. But, so it does have veterinary, it has veterinary applications, but it has been used for decades in Africa to stop malaria. And because of that, it won the Nobel Prize, or the guy that invented it won the Nobel Prize in 2015. So it has a lot of wide-ranging antiviral properties. The best example of this is the Uttar Pradesh province in India, which has a population of 230 million. So it's on the order of the United States. It's 2/3 the size of the United States. It's a province in India that sent out Zerverto packs, which is if I remember correctly, it's ivermectin and doxycycline, but it's definitely ivermectin and an antibiotic that helps guard against secondary infections if you get COVID and start getting pneumonia. So the deal is they gave out all of his ivermectin for free, basically, and they ended up having no spike in cases or deaths through the entire season, to the point that out of 230 million people in this province, something like 59 died in a year of COVID. So it is very well proven. It's got the idea that it's that it's unsafe and unproven, both of which are just absolute lies.
Yeah.
And this goes to the idea that bureaucrats are running public health now. And that's what's really dangerous, is that they have a political agenda for what they're putting forth. And I don't even mean that as a conspiracy theory. I think it's true. It's self-evident.
Yeah, it's true.
It's self-evident that politics is trumping the effectiveness of existing drugs. And I think I don't want to speak out of school here. Can I mention the other aspect of your Glenn's hospital stay with the monoclonal antibodies?
Yeah, that absolutely. Go ahead, and I'll clarify details if need be. Yeah, go ahead.
Yeah. The point being that while he was in the hospital getting, is it Kamala Harris or Jay Inslee removed from his body?
That would have been the Jay Inslee bag. Yes. Yes.
So he's getting his port taken out surgically and his colostomy bag taken out.
Right.
And he tests positive for COVID-19. And you immediately, as I recall the story, asked for monoclonal antibody treatment, and they denied it because it was an outpatient treatment. And they're like, okay, so you said, okay, let's get it scheduled, and they just ignored you.
Exactly.
And that blows my mind. They could have, if he had died of COVID, that would have been the direct result of that action.
Absolutely.
They would have murdered him. And you could call that attempted murder. That kind of bureaucratic intervention into the exam room with the doctor is unconscionable. It all started with Medicaid, but then it got greatly expanded by Obamacare, and now we have so much intervention by untrained bureaucrats that you have to take control of your own health. And this is where the emergency preparedness stuff comes in.
Yes.
You have to take your own control of your own health. You have to have an advocate who you can trust when you're incapacitated and unable to advocate for yourself. And you have to be prepared with the medications and the doctors that you know will be effective. So if you go to FLCCC website, COVID-19 critical COVID-19criticalcare.com. There are other websites as well, the AFLDS and other organizations, but you can get connected with a telemedicine appointment with a doctor that will listen to you and respect your wishes and get you prescriptions that you can fill yourself. The other option is to order ivermectin from India. But the point is here that as our government slowly implodes upon itself in the bureaucratic state, it's trying to exert more and more control over every aspect of people's private lives, whether it's medicine, whether it's commerce, whether it's consumer goods, inflation, monetary supply, all that stuff, right?
Right.
So knowing that we have reached an advanced bureaucratic state that is completely out of control, it's up to each individual to take control back for their own health. And that's where the emergency preparedness thing comes in. And that's where you need to really know your stuff and get prepared now.
So, yes, and I want to speak to that because I know you've in the last few weeks, your knowledge of all of this, especially with this summit, has increased. And trust me, so is mine. So really quick, I want to give a quick shout out to our last sponsor, which is awesome. It is U.S. Law Shield. They're a new sponsor of ours, especially as we watch a certain high-profile case go before a jury here this week, and we watch what happens when someone defends themselves and somebody takes umbrage with that and decides to try to ruin a young man's life. U.S. Law Shield is the legal services that you need to protect yourself legally from that kind of life-changing devastation when you defend yourself whether it be with a firearm or you defend yourself with your fists. I'm encourage you to go check out US Law Shield at our website at prepping2-0.com. Great folks over there. So this is what I really want to talk about. And again, this is my experience. Right before, I'm going to say the first couple weeks of October, I was actively looking to get, and I'm not kidding, in the month since then, it has gotten exponentially easier to get. But at the beginning of October, it was contraband, just about. I was able to get basically a half course of ivermectin for someone of my body weight. And I was working really hard at the time to try to get ivermectin for Joel. And actually, he and I are similar enough body weight that if he gets it, he gets to use it. If I get it, I get to use it. And then I was working on getting some for Glenn. Hard to get at the time. Now it's a whole lot easier. And so, because if you start taking that as soon as you have symptoms and or have your positive test, based upon what your doctor or whoever has prescribed it to you, you can save your life. I would honestly say even my half dose that I took in the beginning days of my COVID probably kept me from either having worse symptoms, possibly even having oxygenation problems, because that's the big deal right there. Go ahead. What were you going to say?
Yeah, no, that's absolutely true, because also because it's such a wide-ranging drug, it also has anti-inflammatory and antihistamine effects. So it actually helps to lower the inflammation in your lungs and allows you to be able to breathe. You know, there are a lot of other supplements, and we might talk about that later on, but there are a lot of things that you can do to lower the histamine reaction to the swelling in your lungs that will allow you to survive. And this could work for not just coronavirus, but a coronavirus, COVID-19, but all the coronaviruses that include the common cold, and also other respiratory issues.
Well, and that's right. I just had someone tell me this morning, it's the inflammation that kills you. It's when your lungs. That's
exactly right. It's not the virus.
No, it's not the virus.
It's the inflammatory response by your body that kills you. Now, and I'm asthmatic as well. I've always since birth, so I've always been aware of things like, coffee or tea helps. The stimulant, the caffeine stimulation helps calm your lung, the tiny little muscles that move your air sacs in and out, that it actually soothes them and stimulates them so that they start working again, that kind of thing. Also, oh gosh, I had a point and I lost. I'll come back to it.
Oh, that's okay. So let's go back to how people are listening going, okay, ivermectin, I need to get some from all. There's lots of places to get it. I do believe that, and I'm asking you because you can correct me if I'm wrong. And I will say this, during the whole panic of all of this, when I was trying to legally get ivermectin and get a doctor to be able to insert him, an outside doctor to insert himself into this hospital and get ivermectin to Glenn, that's a very difficult process. And I knew I might need a legal help to do that. And I was prepared to do that. But how can someone get ivermectin right now? I know FLCC at their website, because people sent me that link 1,000 times, which was wonderful. But at some point I'm like, stop. That's not helping. I need a doctor. They have ways that you can do a telemedicine conference, and you might have to wait a day or two to get it because they are very backlogged, and get a prescription. Now, can you take that prescription and go to a common, well-known chain of pharmacies? No. You need to find a local, probably what's called a compounding pharmacy, where they are not, controlled by corporate, where they're much more independent. So tell us about that. And we have about 4 minutes. So go for it, Jeff.
Yeah, definitely. You definitely want to find a doctor and a pharmacy that you can trust.
Yes.
And this goes to our previous conversation about relocating during a collapse or ahead of a collapse. And as you know, I've relocated from Portland, Oregon to the swamps of Florida. So it's a bit of a culture shock.
Yes, it is.
But one of the things I'm doing, and I'm going to do this week, is to call around to all the doctors that I can find in the area and specifically ask them what their COVID treatment protocols are, and if they are willing to use early treatment protocols, or if they're just going to put me on a vent after I get really sick and go to the ER.
Absolutely.
That's a vital question, because so many, and it's a political pressure. So many doctors are so afraid of going outside of the dictates of the government because they're being threatened by state licensing boards, they're being threatened by medical associations, they're being threatened by insurance companies, and they're being threatened by their hospital networks. So those are vital questions to ask. And yes, you also need to find an independent pharmacy, corporate pharmacies. Like I know people that have gone to Walgreens and CVS and been told, not only are we not going to fill that prescription that was written for you by a licensed physician with a medical degree, but you should feel guilty for even trying to do something so dangerous as filling a prescription for ivermectin. So call around to pharmacies. The FLCCC website lists a bunch of pharmacies that will fill these prescriptions for you. And these are legal. These are legal prescriptions written by people with medical degrees.
And there's many online pharmacies that if you bring them, and correct me if I'm wrong, one of those FLCC doctors, you can do this online. So, but the key is, and we only have a couple of minutes, the key is to do it now. You don't have to be symptomatic. You can say, I'm doing this in preparation for, and they will give you that script in case. So go get it filled and have it on hand.
There are prophylactic courses that you can take ivermectin prior to infection. Yes. And then there are also higher doses for when you are actually infected. Call around to the different clinics in your area and ask them specifically about that. Also, I have to give a huge shout out to monoclonal antibodies. Yes. I know people, you're supposed to get it before day 7. But I know people that got it at day 9, day 11, day 12, and it kept them from dying. Like one person in particular was delirious and slipping away, and it turned them around completely. Yeah. So call around and ask about that as well.
Absolutely. So, folks, we have so much more to talk about on the other side in the after show. This is a good show to realize we're going to talk about so much more. But my goodness, if this isn't a topic that truly tells you and brings to light and life the words of Benjamin Franklin, failing to prepare is preparing to fail. And failure, when you're talking about COVID, it can be deadly. Again, we have stepped right up to the gates of death, and we're able to step back, and we feel very blessed. So, ladies and gentlemen, have a great week. We will check in with you next week. Take care.
You've been listening to Prepping 2.0 with authors Glenn Tate and Shelby Gallagher. All the information you've heard today, including all our previous shows, is online at prepping2-0.com. Find out more about Glenn's books at 299days.com and Shelby's books at agreatstate.com. Until next time, be smart, be safe, and be prepared.